Hi, this is Dr. A. Vandiveer Strait of Wilton Dental Associates, and my blog is Straight Talk. In the previous blogs, we've been talking about preventive care and how to prevent dental disease, how to save tons of money and aggravation, and how to stay healthy for the rest of your life. In our office, we've been doing this now for many, many, many years, and we have thousands of people who have enjoyed those benefits, including myself and my family and all my friends that come here. And I hope that I can give you that same insight and knowledge so that you too can stay healthy and never get new dental disease. Last time we talked about the bacteria that cause it, and about what can be done and how the system works to get your mouth healthy and get rid of the causative factors, which are the bacteria that can not only cause problems in your mouth but also throughout your body. The system that we use takes some time to do, and toothbrushing is one part of it. The fact is that toothbrushing should be a small part of it, but it's an important part, so I'm going to cover that today. But I want to emphasize the fact that, if you're going to use a system that is going to be practical, the whole system shouldn't take more than about 5 minutes a day. So that leaves toothbrushing a very short period of time, because there's actually 3 other things you need to do. So let's start out with, why doesn't toothbrushing by itself work? It's pretty obvious. Just hold this model up. I thought I'd show you this model just because it illustrates pretty clearly why toothbrushing by itself will not keep your mouth healthy. The fact that there's 155,000 dentists all busy filling cavities and treating gum disease is a pretty good indicator. Okay, but start out with that. This side of your tooth is the only part you can brush. That's the inside, and this is the outside. This is the side that faces another tooth, and that's more than half, and you can't get there with a toothbrush. So in the back of your mouth, that's an upper molar, but in the back of your mouth, toothbrushing is not getting even half the surface of your teeth. So let's start with that, but let's understand that toothbrushing still is very critical. So what kind of toothbrush do you use? Is it working fast enough for you? Well, you might say yes, but I'm going to tell you that the answer really is no, okay? Because we have patients come into our practice regularly, and one of the first things we do is obviously try to find out, are they effective? Well, we don't look in the mouth to see if they have dental disease, because it could take years for the teeth to break down. So every time you go, you don't necessarily find something wrong, but in the long run you will. Well, how do you predict that? And right there you predict it. You use a microscope. You take a sample of plaque. If there's a high activity, we have pathogens. If you don't, you don't. Okay, and that's what we do. And so that's how we evaluate whether you're being successful and effective with what you're doing. So let's talk about the individual toothbrush. Now, you probably all use some sort of a toothbrush, right? This one here is happens to be an electronic one, but the bristles and everything are about the same. Individual bristles are just pieces of plastic like your finger, and they're not too effective at brushing. Try to clean a piece of glass with the end of your finger, get an idea how poorly a single bristle really works. It takes just too long to do it with a hand toothbrush. Years ago, we had something that was actually better than we have today, and that was we had toothbrushes that were made with natural bristles. Now, natural bristles have multiple tufts on the ends. That means that every bristle is sort of like 50 bristles. They really work pretty darn well. And you can do a pretty good job in a not too long a period of time with a natural bristle brush, but they're not available anymore for a couple of very good reasons. One is they harbor bacteria terribly, and secondly, they wear out quickly. So you have to replace them every month. So that's not too practical, and that's why we have nylon bristles. We've tried to make them more efficient by making electronic brushes, and most electric brushes do improve things a little bit, but they still don't solve it. And we realized after a great deal of evaluation that the really only way we could make sure that you were getting results was to have some evaluations done. And we came up with the idea that the ultrasonic, because each bristle is rotating many thousands of revolutions per second, or per minute anyway, that it was quite efficient, and our results have proven that. So we recommend in our office really only one brush. I'm sure there's other ones out there, but they have to be ultrasonic. They have to make the bristles not go like this or around in circles like spin brushes and things. They have to just sort of sit still and turn very, very fast. many thousands of RPMs. And we currently recommend, the only one we do is the one made by Philips Corporation called the Sonicare. You may have heard of it. I'm not advertising it. I'm not telling you that's the brush to get. I'm just telling you that in our office we found that's really the only one that's very efficient. And there may be other ones out there, and we'd like to know more about it, but we're always looking for new things, and we present them to you and to our patients as soon as we find something like that. We'll be talking about many other types of home care devices. So when you brush, the most important thing is to remember that you're trying to brush along the gum line, not to brush just the inside or the facial part of your tooth too much. I mean, yes, it gets stains off, but all the bad bacteria, remember, don't like oxygen. They're all on the gum line in between the teeth and things like that. So if you're going around your crevices along the gum line with your toothbrush, you're doing the best job, and that's really what we recommend. The tops of your teeth are pretty much clean by eating, as long as they're in function. Other than stains, the main purpose is along the area where the gum line meets the tooth, and that will usually do a very good job. I hope you've enjoyed this presentation. Next time we're going to talk about flossing and how to clean between teeth, and also maybe a little bit more about what we'll be talking about in the future. If you want more information, please go to our website. It's WiltonDentalAssociates.com. That's WiltonDentalAssociates.com. Or call our office at 203-761-0223. We'll see you soon, and thank you very much for watching. Bye-bye now.